Welcome everybody, this is Gary Beck, your naturopath from the Maximum Wellbeing Thyroid Studio, and with me today I have Dr. Daryl Turner. Dr. Daryl Turner, welcome.
Thank you very much, Gary, for inviting me along.
Now, Dr. Turner is one of those people that has done all sorts of things throughout his career, and as a doctor he invented the ThyroFlex tool, which is the device we use here in the clinic to give an accurate assessment of your thyroid function. And when we test you, if you are showing signs that your thyroid is out of whack and not producing enough of thyroid hormone, it's quite likely you will get put on a protocol using a thyroid formulation that Dr. Turner has created, and it may be something like this, the thyroid. And I just wanted to ask Dr. Turner today, what is the difference between this formula and what the doctors may commonly prescribe people?
Okay, the most commonly prescribed thyroid, 98% of the time prescribed in Australia, is a synthetic thyroid called levothyroxine. It is synthetic. It's T4 only, and I'll explain about the T's in a few minutes, and the body likes what it sees to start off with, and then the efficacy starts to deteriorate. So the body does not like synthetic. The body needs T1, T2, T3, T4 and T7. They are missing. And by the way, needs iodine and D3. If you are on synthetic T4 and you are not on iodine to convert it into usable form and the D3 to allow it to go into the mitochondria, then you are being undertreated, mistreated, or misdiagnosed. I actually manufacture a porcine thyroid with T1, T2, T3, T4 and T7, and I manufacture a bovine thyroid with the same T's in. And we use both quite effectively. What we found in our clinical trials on thousands of people is that we're able to hold the patient a lot better for life. Now, when I say for life, if you have a thyroid condition, it's inherited from one of your parents. If you need thyroid medication, unfortunately, you're going to be on that medication for the rest of your life, as are your siblings and your children, because it is a hereditary problem. It's inherited from your mother or father. So the type of medication, the type of thyroid medication you take is absolutely essential. Once again, I want to mention that levothyroxine, which goes by quite a few names in Australia, but it's synthetic T4, does not work. Even if you're using a compounded T3, T4 here, they're both synthetic. They do not work. The only thing that works effectively is natural bioidentical thyroid derived from porcine or bovine. And that is what we have available, both porcine and bovine. These are prescription medications, and we actually have a complete scripting service for you, where our doctors, through Dr. Gary, will actually script your prescriptions, and we will ship out the right type of thyroid medication. In fact, the ThyroFlex will get you onto exactly the right amount of medication you need. There's no guessing game. And so if you need 1 grain or 2 grains or 3 grains or 4 grains or 5 grains or 6 grains, we are able to get you onto the right dosage within 30-day intervals, and we can keep you at that dosage according to the tests that we must run on you every 6 months to renew your prescription.
So there it is, folks. There is thyroid products that work and thyroid products that don't work. And which category are you in? I do wonder. And this is just part of the picture. Remember what Dr. Turner said at the beginning of this video, is that even if you're on a prescription from your doctor and you have the levothyroxine product, if you don't have adequate iodine and you don't have adequate vitamin D3, it's not going to work properly. So really, we need to start looking and understanding that the body and what it does is it functions only if everything is in play. And this is part of the service we offer. So thyroid products, if you're on a thyroxine product and you want it to be tested, that's real easy for us to do. We can get you in here, show you what's going on, and if you know you don't feel right, I'm certain that the Thyroflex test will also show that things are not right. And the nice thing is that as we put changes in place, we're able to monitor and show you the improvement that you will be feeling in your body as well. So yeah, thank you for that insight, Dr. Turner.
Thank you, and I want to just add one more. So we don't want to put you onto a seesaw with it. Your general GP, who's not an expert in thyroid, puts you onto 15 micrograms of levothyroxine, then he puts you onto 25, then he puts you onto 30, then he puts you onto 35, then he puts you onto 50, as you seesaw through the spiral into the symptoms. We want you to get you onto the right dose with something that is effective, not trial and error. In other words, we want your symptoms to disappear, and we have a lot of success with your symptoms disappearing at the right dose.
So that's what it's about, folks. Treating and testing and determining the exact dose for you as an individual. So yeah, should we wrap that one up, Dr. Turner?
Thank you very much.
Thank you.
I enjoyed being here.
Thank you, everybody. Bye for now.